So we left here in the previous video, and we are now discussing the spinal cord and the associated tracts. So this should keep in mind that legs are lateral. So lateral spinothalamic, corticospinal and spinothalamic tracts. You can see here the lateral spinothalamic tracts and anterior corticospinal tracts. These tracts are located laterally, and these dorsal columns are organized as you are with hands at sides. So these dorsal columns are located somewhat at this side: sacral, lumbar, thoracic, and cervical. So the pressure, vibration, fine touch, consciousness, and proprioceptions are carried by these structures. So again, the anterior thalamic tracts are located on the anterior side, which carry the crude touch and pressure, and the ascending lateral spinothalamic tracts, these which are lateral, carry or belong to the sacral, and the medial, which belong to the cervical, and these carry pain and temperature. So these lateral corticospinal tracts which are descending, they carry voluntary response, motor response, which will happen in response to these sensations, temperature or pain. Similarly, the anterior spinal thalamic tracts, which are descending, also carry the information related to motor system. So let us go to the next page. This is related to spinal tract anatomy and function. Spinal tract and dorsal column, synapse and then cross. Corticospinal tract, descending tract, crosses and then synapse. So these ascending tracts, first synapse, then cross, and descending tracts, first cross, then synapse. So this is very important, you should keep it in mind. And what are the functions? Spinothalamic tracts, dorsal columns, and corticospinal. Spinothalamic means from spinal cord to thalamus, from means these are ascending tracts. These first synapse, then cross, first synapse, then cross, first synapse, then cross. These carry pain and temperature. First order neuron, these are the sensory nerve endings. These are A delta and C fibers of the pseudo unipolar neuron in the dorsal root ganglion. These enter the spinal cord. These are the first order neurons. First synapse will form in the posterior horn at the level of spinal cord, and the second order neuron will decussate in the spinal cord as the anterior white commissure. Ascending contralaterally, so we can see here these fibers first synapse at the level spinal cord, then decussate and went anteriorly on contralateral side. Then there will be second synapse, which is at the level of ventroposterolateral thalamic nuclei. And the third order neuron, which projects to the primary somatosensory cortex. These will be sensed here. These pain and temperature sensations at last will reach at the third order neuron, which is the somatosensory cortex. So what are the dorsal columns? These carry pressure, vibration, fine touch, and proprioception. So the first order neurons These are the free nerve endings of the pseudo-unipolar neuron, same like these in the dorsal root ganglion, enter the spinal cord, ascend ipsilaterally in the dorsal column. First synapse will be with the nucleus gracilis, nucleus cutaneous at the ipsilateral medulla. And the second order neuron decussate in medulla ascends contralaterally as the medial lemniscus, where at the level of ventral posterolateral thalamus and projects to the primary somatosensory cortex, where the information will be reviewed and the signal will sent from cortex to the spinal cord via the corticospinal tracts. These carry voluntary movements. Let us suppose if we receive a signal that uh, there is a pain with some activity in our foot, so the cortex will send signal via the spinal cord to the foot that please remove or take aside the foot. So these are upper motor neuron, primary motor cortex, descends ipsilaterally through the posterior limb of internal capsule and cerebral peduncle decussate at the caudal medulla. As we discussed previously, first will cross or decussate and then synapse. So decussate at the level of caudal medulla, pyramidal decussation descends contralaterally. So the first synapse will form at the level of spinal cord. This is the first synapse, which is after decussation. So the second order neuron are the lower motor neurons. These leave the spinal cord. And the second order synapse is the neuromuscular junction, which is at the level of skeletal muscles. So this is also shown in the picture. These are the ascending tracts, anterior white commissure, then at the level of medulla, and then they reach the final destination, which is the primary somatosensory cortex. Similar thing is related to this, but this is somewhat different. It will start from the primary motor cortex, then they will decussate at the level of medulla, and after decussation, they will form the first synapse at the level of spinal cord. And here is the neuromuscular junction. So clinical reflexes count up in order. So what are the reflexes? Main nerve roots are in bold letters. So at this level C5, then C7, and at knee level L4, and at foot level S1. So Achilles reflex, we also call it tendon reflex. So the main nerves involved in the S1 and associated with it involve the S2. Buckle my shoe. So you can remember with it, buckle my shoe. The second one is the patellar reflex. You can see here the main nerve is the L4 and the associated nerve is L2. Kick the door. Bicep and brachioradialis reflex, which have the cranial nerve, cervical nerve C5 to C6. Pick up stick. Then the tricep reflex, which is carried with the C7 and associated nerves are C6 and C8. Lay them straight. Mhm. Additional reflex, cremasteric reflexes. These are carried out by the L1 and L2, these are testicular move, and the anal wing reflex, which is carried out with the S3 and S4 wings galore. Reflex grading. If the reflex is absent, then it is graded as 0. If hypoactive, 1. If normal, 2. If hyperactive, then 3. If clonus is present, then it is plus 4. Primitive reflexes. These are also very important. These are the CNS reflexes that are present in a healthy infant but are absent in a neurologically intact adult. Normally disappears with the first year of life. These primitive reflexes are inhibited by a mature developing frontal lobe. They may re-emerge in adult following frontal lobe lesion, loss of inhibition of these reflexes. For example, Moro reflex, hang on for life reflex. Adduct extend arm when started and then draw together. Hang on for life. Abduct, extend arms when started. When startled, sorry. Abduct, extend arm when startled and then draw together. This is Moro reflex. Rooting reflex, movement of head toward the one side of if cheek or mouth is stroked by the nipple or something else. This is nipple seeking reflex. Sucking reflex, sucking in response when roof of the mouth is touched. Palm reflex, curling of fingers if palm is stroked. Plantar reflex, dorsiflexion of large toe and fining of other toe with plantar stimulation. Babinski sign, present if this reflex is in an adult, which may signify an upper motor neuron lesion. Gallant reflex, stroking along one side of the spine while newborn is in ventral suspension face down causes lateral flexion of lower body towards stimulated side. So these are the very basic reflexes which should not be normally present in an adult individual. What are the landmarks of dermatome? C2 is located on the posterior half of the skull. C2. C3 high trunkless shirt. Diaphragm and gallbladder pain refer to the right shoulder via phrenic nerve. C3, 4, 5 keeps the diaphragm alive. C4 lower collar shirt. Yes, here the C4 lower collar shirt. C6 includes thumbs. Thumbs up sign on left hand looks like a 6. Thumbs up sign on left hand looks like a 6. Okay, we admit. T4 at the nipple. T4 at the teat pore. T4. T7 at the xiphoid process. 7 letters in the xiphoid. So T7. T10 at the umbilicus belly button. Point of referred pain in early appendicitis. L1 at the inguinal ligament. L4 include the kneecaps. Down on A double L fours, all fours. Include the kneecap. Down on all four. S2, 3, and 4 sensation of pineal and anal zone. S3, 2, 3, 4 keep the penis off the floor. Oh, it means it causes erection. Yes. So these are the area of lesion and what would happen if these occur. Prefrontal cortex, frontal lobe syndrome. It causes disinhibition, hyperphagia, impulsivity, loss of empathy, impaired executive functions, and akinetic autism seen in frontotemporal dementia.